And with that, it's now my pleasure to introduce our first two speakers for today. Dr. Dave DuBois, who is the New Mexico State climatologist, and Dr. Chelsea Langer with the New Mexico Department of Health Environment Health Epidemiology Bureau. So Dr. DuBois and Dr. Langer, you have the floor. Thank you.
All right. This is Dave DuBois. I'm going to share my slides. And if you guys give me the reins to share, that'd be great. All right. Awesome. So I will go ahead and get started, and then Chelsea will take over. Let me maximize my screen. All right. Just can somebody give me a thumbs up?
Looks great.
Okay, great. Thank you. Well, I am honored to be the first speaker here, and just great to see you all attend here. Appreciate that. Since I'm going to open up, I'm going to talk about where we are in terms of the data. I titled my talk, Monitoring New Mexico Heat Trends. Talk a little bit more about that, but basically I'm the state climatologist. I live in Las Cruces, and I'm going to be talking a little bit about Las Cruces and other places, the whole state, for example. But I'm just going to dig right in, talk about where we are, where we sit in terms of heat waves. This one slide, I've been presenting several talks in a row here. And basically, it's the same trend. It's the same story here. So each of the counties, there's 33 counties in New Mexico. And what I've been doing, I track the high temperatures in the summer. So this is June, July, August high temperatures in degrees Fahrenheit, and this is the trend. So if you were to graph out annual average high temperatures in the summer from 1970 to 2023, this is the slope of the line. So basically the trend of high temperatures, and this is in degrees Fahrenheit per decade. So this is our decadal trend for each county. As you can see, they're all positive, of course, and they're varying from, I think we got as little as 0.4 to about 1 degrees Fahrenheit per decade. So you can see our trends are going upwards. And I'll show you some examples in a minute in terms of for one location. But this is kind of the overall trend we're seeing. And this is not just New Mexico, but all over the place. This is pretty common. So I just kind of see kind of where do we stand in terms of our recent weather and how it ranks in terms of our climate. So this is the basically ranking for 2024 summer. So the June, July, August of 2024, how does that compare with the past? So you can see by county here, and there's a ranking. So we've got the numbers there are ranks basically over the last 130 years. How does it sit? So you can see there's a bunch of counties that are colored the darkest, what is that, kind of reddish orange, rust color. Those are the hottest, the warmest summer on record for this last year, June, July, August. So statewide was third warmest on record. So you can see the majority of the western side of the state had the highest temperatures June, July, August. So that's kind of our context. And we've had several summers in a row that are very warm, and it looks like from our Climate Prediction Center outlooks, they're expecting to look at above average temperatures for this coming summer. So kind of put that on a bookmark for later. But let's continue on to look at 2024. How many of our weather stations that we have, how many did reach 100-degree days? So how many days did they record 100 degrees? So you can see like places like Carlsbad, we had 60 days that reached 100 degrees, kind of over there in Eddy and Lee County. Those are kind of a hot spot, as well as in Chavez County. Roswell had 56 days where they reached at least 100 degrees. And so just scattered around, even in central New Mexico along the Rio Grande Valley, you saw 5 in Albuquerque, 10 in Los Lunas, etc. So we're seeing that all across the state. And then we even actually had 2023 was actually a little bit more. We had more widespread heat waves across the state, but 2024 was right up there. We had 39 in Las Cruces. And so I just wanted to show kind of example of the kind of data that we look at in terms of surveillance and looking at high temperatures. And this is one day snapshot from 2024, June 14th of last year. And we colored it in terms of the number, basically the temperatures ranging, um, the high temperatures of that day. And you can see that darkest red, really dark red, those are the days that were in that above 105 on that day. So you can see, and I think there's going to be another talk about rural heat. So that you can see a lot of that area is covering rural areas. And so we had a high of 107 at the Las Cruces campus at New Mexico State, 105s in Los Lunas and Brantley Dam. So it's a widespread, and it was mainly the areas where lower elevation that we had the highest temperatures on that particular one day. Just wanted to show kind of the widespread high temperatures when we do get a heat wave. Where does it all cover? And I just wanted to spotlight a little bit about Las Cruces. This is we've been monitoring climate weather at the Las Cruces campus since 1892, and with very few missing days. And so it's a good place to track trends across our area, especially southern New Mexico. And so these are the number of 100-degree days per year. So that means we look at one particular year and then how many days did we exceed equal to 100-degree days, and we count them. So we can see, like, during the majority of this last century, we kind of we're dancing around 10, maybe a little less than 10 on average. In a few years, like the 50s, we exceeded 30, and we've had a few years that are pretty warm, but the average was kind of well within 10 days on average. But since the 70s, we've been seeing that trend upwards. And so in the last 2 years have been particularly worrisome when we had 52 days of 100-degree days in Las Cruces in 2023, and then last year we had 39 days. And so what I wanted to do is kind of look at a little more in detail on that. And so I wanted to know, when do they occur, those 100-degree days? Because we want to be able to predict those and kind of look, are there any trends? Do we see any changes in that over the last 130 years? And so I looked at when did we first get a 100-degree day? What time of year? What day of the year did we get those? And then, so that's what I plotted here. On the x-axis is the date of starting from May all the way to August. And then on the y-axis, I made the for that particular, so each dot is a year. So how many days per year did we get 100-degree days? So that's what we're plotting here. And so basically, you can kind of see if all the dots, we have 100-degree started really early in 1989. It's basically around the end of the first week in May, actually, we got it. And then the latest was all the way back in the second week of July. And so that's kind of our spread of our first 100-degree days. This is not all 100-degree days, but when did we first see the first one? And so what I wanted to do is kind of see, has it changed over time? And so I colored the last 25 years red, and then I left all the other from 1999 all the way back to 1892 as black. And so then I calculated I looked at the average start of the first 100-degree days. On average, we start a 100-degree day on June 15th. Those are all the black dots. And then the red, the last 25 years, we started our 100-degree days on June 6th. So it's actually, we started them earlier in Las Cruces. And this is kind of an ongoing kind of deep dive data analysis of the whole state. And then this is kind of just a preliminary view of that. So I wanted to know, is this a trend across the state? And I don't have the answer to that yet. So maybe on a subsequent meeting, I can talk about any changes across New Mexico, or is just kind of an outlier that we're seeing. Maybe a week earlier, the 100 degree days are occurring earlier. So that's just kind of want to put a thumbnail in there, just kind of look at it later. And I'm also looking at, how do the the all-time maximum temperatures, how do they vary in terms of elevation? So it's kind of my grad student, Shihab Udin, who's also on this call, and this is kind of his work that he's been providing to me, that basically looking at how do the highs vary across New Mexico? New Mexico varies quite a bit of elevation. We've got stations all the way down on the Pecos that border Texas that are lowest elevations, and we've got areas and even communities that are high up, 9,000 feet. We have a weather station at 10,000 feet just to see what temperatures that we see. And this is all the stations in New Mexico that I have access to, and we graph them in terms of temperature. And basically, it's kind of I provide this to kind of get a sense of where do we sit in terms of extreme temperatures in New Mexico and their variability by elevation, because we have so many different communities at different elevations. And so I wanted to also talk about kind of some of our new initiatives that we've been working on in the past 5 years. We've gotten money from this federal appropriations as well as state legislature, which are very appreciative of both of those, to expand our weather monitoring in New Mexico. So these are all mostly new stations that we've gotten, and we've got instrumentation and telemetry at all those triangles, and all the different colors are the different types of weather stations, but they all have in common measuring temperature for sure and precipitation. And so this is a new resource that we're working on and providing information on heat as well as drought and other weather parameters. So this is kind of a new data source that's going to be helpful for those who are into data looking at things. And so I just wanted to provide, like last year, kind of just, I guess, kind of a real quick snapshot on where do we find the hottest temperatures across our 200 station network. And so we've actually had some of our hottest temperatures in Doniana and down in Eddy County. We had almost 108.6 in Las Cruces, and also another 108 in Carlsbad, as well as over at Loving High School. And because those are kind of the areas we want to really pay attention to. There may be some small microclimates in there that actually make it a little warmer than average than the airport temperatures that we're used to looking at. So this is one of the resources that we have, especially like in high school when we have athletics going on, where we will have some data there on site to help with that for decision making. So I just wanted to show real quick kind of the highs from last year, and they may be different than the official highs, but they're for those specific areas. So I just wanted to kind of show some updates of where we are with our weather collection, some new resources that are available for those who are using weather data, as well as looking at trends. So as I said early in the talk, the latest Climate Prediction Center outlooks for the summer are showing above average temperatures for all of New Mexico, as well as parts of in the Four Corners in that whole area of the Southwest. So it's kind of a preparation for, if we were to see the temperatures that we saw in 23 and 24, how would you change your operations and behaviors in seeing, we've had in 23, we had 109-degree temperature in Las Cruces. If we were to see that again, how would that change your behavior? And so that could happen. I'm not saying it will, but that could be on our plate for what we're seeing. So I'll leave it at that. There's my contact information. I appreciate being able to talk here, and I'm gonna hand it off to Chelsea next. Thank you.
Dr. DuBois, thank you very much for the presentation. We'll go to Dr. Langer's portion now. I think there are going to be a couple of minutes that we can take a few questions. So for any of the attendees, if you have questions that you would like to return to, go ahead and put them in the chat. And after Dr. Langer is finished, we'll put them both we'll put those questions to both of you. Thank you.
Thank you. Can you see my screen all right?
Yes, looks great.
Okay, perfect. Also an Aggie, so I liked the Las Cruces love earlier. I'm with the Department of Health. I'll be talking about heat and health impacts around the state. So first of all, with the Environmental Public Health Tracking Program, it's a CDC-funded network of 33 states around the country, and our main product is this public-facing portal. So the QR code takes you to the portal. This is the home page. And then on the right, we have the heat-related illness page. So it walks through, what is it, how to recognize it, how to treat it, how to protect yourself. And then we'll get into what more of the data and queries look like. Now, I always like to start with just a brief, what heat illness can look like. So the first sign of heat illness is if you are thirsty, dehydration being a big part of heat illness. So with heat exhaustion, we see like nausea, vomiting, rapid heart rate, sweaty skin, head hurts, feeling kind of weak, dizzy, cramps, generally not feeling very good. Heat stroke is more serious with a high body temperature of over 103 degrees. At that point, there's little to no sweating. The skin is red, hot, and dry. Again, rapid heart rate, convulsions, confusion, disorientation, can faint, lead to coma, and eventually death. It is important to note too that it doesn't necessarily progress linearly, like you don't necessarily go through all of the symptoms in order, and it can go from feeling okay to being in pretty serious trouble very quickly. For risk factors, so there are environmental and personal risk factors. The most obvious with environmental is if it is hot outside or we are in the middle of a heat wave. Some other environmental factors in the man-made environment, if somebody has limited access to transportation, limited access to medical care, if there are no cooling centers people can go to cool off, those can all contribute to a higher risk of heat illness. Also, we have the urban heat island effect where, the concrete city centers that have less shade are hotter. And then for personal risk factors, we have age, so younger, children under 5, and then adults over 65. If someone is overweight, if someone has existing medical conditions like diabetes or heart disease, they're at higher risk of experiencing heat illness. If someone is socially isolated, if they use alcohol or other substances. And then there's a long list of fairly common medications that can impair the body's ability to regulate temperature or inhibit perspiration, which is how your body cools off. I also like to spend a minute just talking more about mental health and heat. So there was a very compelling article in the Washington Post a couple of summers ago. It was in 2023, where it was in Phoenix, and this man who had schizophrenia and had a home, had a family, was hearing voices and got into a fight with his girlfriend and walked away from his home in July in Phoenix. And within 36 hours, he had died. I think it's a very compelling example of the nuances with people with serious mental health, mental illnesses and heat. So people with serious mental illness like schizophrenia or schizoaffective disorder or bipolar don't always make rational decisions. So walking away from your home in July in Phoenix is not a rational decision. There's also, with the illness, people who have serious mental illness, their bodies are not able to regulate temperatures as well as people without serious mental illness. And then the medications used to treat serious mental illness are on the list of medications that inhibit the body's ability to regulate temperature or inhibit perspiration. So really, they can't win no matter what. So the point of this slide is really to show that we start to see heat and the effects of heat illness, or we start to see heat illness and the effects of heat at temperatures that aren't anywhere near extreme or what we would consider extreme. So the top line in red is 90 degrees. The bottom line in green is 80 degrees. The orange squiggly line is the number of heat-related emergency department visits in the Albuquerque metro area. Sorry, no. The orange squiggly line is the temperature in the Albuquerque metro area, and then the bottom purple line is the number of heat-related emergency department visits in the Albuquerque area. So around 80 degrees is when we start to see, pretty consistently more heat illness ED visits coming in. And then at 90 degrees is when it really picks up. I'll take a quick note to say this also matches what is in the proposed heat standard for outdoor workers that Garth will talk about later. And this also, I saw Brian in the chat. So Brian Woods was an epidemiologist with our program for a long time and did an analysis that also showed, 80, 90, and 100, like we start to see heat illness around 80 degrees, which again is not anywhere near extreme, and especially what we would consider extreme in New Mexico. So the next 3 slides walk through data that we have on the tracking portal. So we'll go through emergency department visits and then hospitalizations and then mortalities. And on the left is a graph with the number of HeatRisk emergency department visits from 2010 to 2023. And then on the right, we have the age-adjusted map of New Mexico divided into the 5 public health regions. And I'll point out, just pay attention to the northwest corner. So with emergency department visits, we see that they about doubled between the early 2010s and 2023, with the southeast and southwest regions having the highest rate of heat stress emergency department visits, followed by the northwest corner. For hospitalizations, we see about the same thing where they about doubled in that time frame. And now we have the southeast region with the highest rate, followed by the northwest region and then the southwest region. And then if we look at mortality, we see that deaths due to heat stress more than tripled in that time frame, with now the northwest region having the highest rate, followed by the southern region. And like Dave mentioned, so it's different around the state, and people experience heat differently and have different heat patterns around the state. So on the portal, you can filter it by county and look at trends over time. So that's what we have here. We looked at Doña Ana County with emergency department visits on the left, and then hospitalizations on the upper right, and deaths on the lower right. And we see that in Doña Ana County, all of those metrics about doubled in the time frame. Now, when looking at data, I always like to think about limitations and what we're missing and what we're potentially not seeing. So with all of the data sources that we have currently on the data portal, they are annual files that we get once a year, usually with a pretty long delay. So we'll get the 24 data sometime this fall, and we only include New Mexico residents. With emergency department and hospitalization data, we also only get the non-federal facilities, so we don't get Indian Health Services or Veteran Affairs data. And we also don't include residents that seek care out of state. So if people are going to, it was timed. If people are going to Texas or Arizona or Colorado, then we don't see that. Okay, sorry. So thinking of the residents for out of state. So this is looking at the EMS data, so like 911 calls for heat related illness. And again, this is Doñana County zoomed in. So Las Cruces is up towards the edge. And then everything in the circle, so everything below La Mesa, all the 911 calls that were transferred to emergency departments, they go to El Paso emergency departments. So we don't see any of those. And then thinking of Indian Health Services and McKinley County. So this is the EMS data for the Gallup area for 2023. And most of these go to Gallup Indian Medical, which again, we don't get. So when looking at the shifting patterns between ED and heat and or hospitalization and mortality data, I did wonder if it was like the northwest corner, if it was lower rate of emergency department visits because we weren't getting the data or because people weren't accessing care in time. And from looking at the 911 calls, it seems like we're missing data rather than necessarily getting care in time. So now looking at the annual file aspect. In 2023, we really used the syndromic surveillance data for the first time, which are near real-time emergency department visits. It is a different data source than we get our annual file. Like it is an optional program that facilities opt into. It's very prone to technical difficulties, but we do get it in close to real time. I also will point out that it has a different definition. So here it's more heat related, where it uses discharge diagnosis as well as clinical notes, as opposed to the annual files that we use on tracking, which are strictly based on discharge diagnosis. So it's not a direct comparison. The syndromic numbers are usually higher, but we do get them in close to real time, and we've done a lot of validation work. So I, for one, feel comfortable using this. So we can go back to 2019 really as the first like reliable year for using syndromic data or the near real-time data. So 2023 is the purple line that has the really sharp peak in July here. And then I had been hoping 23 would be an anomaly, but as Dave showed, 2024 was just as hot. So what the interesting thing with emergency department visits is the actual number was pretty comparable to 23, but it didn't have the same sharp peak that we got here in 23 in July. It was more just like higher across the board, except for July, because July 23 was so high. And then last year especially, there was a lot of interest in heat-related deaths. So we have an agreement with the Office of the Medical Investigator where we receive reports every 2 weeks. These come with a 90-day delay, so it's not as real time as we would prefer, but it is better than waiting a year for data. Not all heat-related deaths go through OMI, so we'll have to wait to get the annual file from Vital Records to see what the total number is. And we get pretty minimal information from OMI and no information on nationality. But we do have a tab on our dashboard, which I think is the next slide, with the numbers from the OMI reports. It looks like I have 1.5 minutes left. I did throw in these slides as resources so people would have when they got my slides, not knowing if I would have time to go through them or not. So I'll just highlight a couple. The dashboard that I just mentioned. So last year we released the heat-related emergency department dashboard. So this is publicly available, and there's a tab for the OMI deaths. And it has, you can do statewide or by region, and then a different tab has, you know, the trends like year over year. We also have urban heat maps that were a partnership with Florida State University. So I think it's 26 towns and cities around the state, with red being higher temperatures, blue being cooler temperatures. And then there's the HeatRisk tool. And then the CDC heat risk tool uses the National Weather Service heat risk tool, but then pulls in some of the health information and also ties in air quality information, which I find helpful. This came up from last year's Partners in Preparedness, where somebody had asked about, like, people in the reservations who don't have electricity or don't have running water, what they can do to kind of prepare themselves. So some passive cooling strategy suggestions. We try to communicate. We have social media posts, press releases, news articles, presentations, and the PSA campaign coming this summer. And that's my cue. So thank you.
Dr. Langer, thank you. And thank you so much. I want to just echo how much that resonated with me in terms of what I actually am seeing in emergency departments and how much has changed over the last couple of years. And Dr. DuBois, thank you very much for showing where the overall trends are and the overall data. And then Dr. Langer, showing how that's affecting our families, our loved ones, our children, who are the people that are starting to be affected in different ways. Can I ask a question for both of you that's coming from the chat? What are the best ways for people to access the data you have presented today, or those types of data? And then if people wanted to try to reach out to you more directly about ways that could be implemented into some of the planning for their communities, what would be your recommendations for each of you?
Well, I'll go ahead and start, and then Chelsea can wrap it up. I think resources, the National Weather Service is a great resources for real-time information in terms of heat risk. I know Chelsea showed a slide of that. It's really good. They do forecasts for the next, I think, 7 days. And there's a new product that uses epidemiological data that Chelsea can maybe highlight on. And that's really good. And I think if they're very open. I know they're limited in terms of the staffing, but if you have a specific question, they are 24/7 office that could answer questions in terms of if you have a specific event that you want covered to talk about forecast and things like that, and not just for heat, for any weather event. I think they're the point contact that I work a lot with them. We get, I put the ZiaMet weather data network link on chat. You can have access to that. If you have any problems, just give me a holler. I think my email is also already on the chat, so I'll let Chelsea wrap it up.
Thanks, Dave. I put a couple of links in the chat to our portal. It is being redesigned, but for now, this is the link, and it will redirect when the new link goes live. But we do have, like the heat illness page that has the background and info. There's the link to the urban heat maps. There's the queries and indicator reports. I have realized not everyone is as familiar with the queries. So if anyone has questions about how to develop something so that it is the most useful for you, I'm very happy to set up a time to walk you through it and chat. And then the PSA campaign will have the call center is gearing up to answer questions with cooling centers, and also, how to recognize heat illness. That's all I can think of right
now. Excellent. Thank you both so much for your expertise and for your willingness to share it with the state. And I think if others have questions for either Dr. Langer or Dr. DuBois, please go ahead and put them in the chat. And really thank you both for your generosity with your time.